Good evening, Right Honourable Patricia Scotland. I'm Anasiu Falekano from Radio and Television Tonga News, all the way from the South Pacific. I understand that the Commonwealth Health Ministers meeting was held today. The main topic was focused on coronavirus. Can you tell us the main outcomes of the meeting?
Well, what we met together in order to share information about what worked, what doesn't work, what each of the regions were doing, and how we could share the information with each other to enable us to respond more easily. And the minister, the health minister for Fiji, gave the outline of what the Pacific was doing in order to address the coronavirus. And the Pacific has done an amazing job. You'll know that of all the countries in the world, there are only 13 countries who have not suffered from the coronavirus, and 10 of those countries are in the Pacific, and Tonga, of course, is one of them. And we talked about the steps that have been taken by each of our countries in order to impact and safeguard the best interests and the health and safety of our people. And the immediate action that was taken in the Pacific has been very beneficial. So we were looking together at all of the countries who have been badly affected, those who are fearful that this virus will come, and the steps that they can take to stop it. So we had a fantastic contribution, as I say, from Fiji, who set out the 3 stages of the program that had been advocated by the people of the Pacific and which had proven to be successful, and it was very well received by all the others. We heard from the United Kingdom, who perhaps has the largest number of deaths in our Commonwealth and have been very grievously affected. And they told us about their experience. But India, of 1.35 billion people, they have remarkably kept the figures very low because they have only got about 73,000 people who have been affected by it. And tragically, they have 2,400 people who've died. But when you compare that to those who've died in the United States, where you have a population of 330 million, but they have had over 80,000 deaths. So we were looking at what worked, what didn't work, and really calling out for solidarity between all of our family members, support for the WHO, and setting out the fact that we must not forget during this coronavirus that there are other illnesses that we need to look at. For example, the non-communicable diseases, the fact that so many of us are struggling with diabetes and obesity and heart disease, and of course they have the cancers. And we were talking about what we have to do to present and protect those who may be left behind, the most vulnerable groups. We were also mentioning the issues of domestic violence, which has gone up during this period, and protecting our women and our girls, and making sure that our children get the sort of help and support that they need so no one is left behind. It was a very fruitful, rich meeting, and we are coming out with a statement which is being perfected now, and the contributions at this meeting were really excellent.
Thank you, Right Honourable Patricia, for that statement and information provided. What were the most common needs requested from the Pacific, including Tonga, that the Commonwealth could assist with?
Well, what we have done is we've created the Commonwealth Coronavirus Centre, in which we have put all the information that is available from across the Commonwealth. We have a Commonwealth tracker, which is embedded in the WHO tracker, but we are also putting into this Commonwealth Coronavirus Resource Centre things like sport that you can do, medication, how you can create the sort of protective materials that you need. But we were also talking about the fact that we, in the small states in particular, have to deal with the climate crisis. So Tonga has not been directly hit, but we know that Cyclone Harold came through the region and devastated Vanuatu. It affected the Solomon Islands, it's affected Fiji and others. And the tragedy for us is this cyclone season is not yet over. So we hope that we won't see more, but we don't know so. We also talked about the fact that the monsoon season is just about to start in Southeast Asia. And then, of course, we have the hurricane season in the Caribbean. There is drought and locusts in Africa and flooding. So we were very much anxious that these things cannot be seen in isolation. There is the coronavirus threat, but there's also the crisis of climate change. And those two put together are going to potentially cause us real difficulties economically, which will be affecting Tonga, because Tonga, as in other countries in the Pacific, do rely on tourism, the fact that no flights are coming in, but also I know that the fisheries have been very badly affected. Many of the fish caught in the Pacific are sold to restaurants and to hotels across the developed world. And of course, the fact that these hotels and the restaurants are all closed are going to have an impact on people's livelihoods as well as their lives. So these are the things that we were talking. Tonga, as I say, is very lucky not to have had any coronavirus cases yet, and the country is very well prepared to handle an outbreak. However, the other problems are still there, and Tonga's healthcare expenditure has been 5.3%. We know that we've been looking and talking for a long time about how we implement universal healthcare coverage and how do you get the money for that and what is going to be the cheapest and best and most effective way of promoting it. But also, you will know that we are creating a database for medicines, because the other thing that we highlighted last year when our health ministers came together, is the disparity in the cost of medication and equipment. So this data bank, this platform we're creating, is to pool knowledge on procurement so that hopefully by sharing we will be able to help each of our countries, but particularly our small countries like Tonga, to be able to access medication and equipment at more affordable prices. Because when we were talking about it, we found that some countries are paying 30 times more for some generic medicines than other countries. So if we can get that right, we can really make a difference to all of our countries.
Tonga is yet to have a case of COVID-19, and we're thankful for that. But do you think that Tonga should be worried about the disease in the Pacific?
Well, I think Tonga, of course, must be worried, but not fearful. Because I think the thing we've learned is that because we have come together, and if you think about the Pacific solidarity, the way the love and the affection of the Pacific people, where it doesn't matter if you're Tongan, you're Fijian, you're Samoan, you're from Solomon Islands, all of us see the Pacific as one Pacific people. We care about each other. And that solidarity, that culture, that ocean-going nation, which has gone right the way through the region, has been very powerful in supporting each other and helping each other, sharing information, sharing resources, and that has been incredibly important. And I think that culture has been one of the things which has been the Pacific strength. And of course, Tonga is known for its strength and its warmth and its kindness of its people. So I think that has been very much treasured and valued.
You mentioned earlier about the many challenges that the small Pacific countries are facing, including Tonga, impacts to the economy and also climate change. What is the Commonwealth doing to help Tonga face these issues?
Well, the first thing is that, as you may know, we have created the Commonwealth Climate Finance Access Hub, and we have had a climate finance advisor in Tonga helping the government, helping the people to make applications. In the past, one of the biggest problems has been that although people have spent a great deal of money preparing these applications to the Green Fund to try and get money for climate change adaptation and mitigation, they haven't been successful. Well, with the help and support of the Climate Finance Advisor that we embedded in the Ministry of Environment and Climate Change, Othaniel Yila, has helped Tonga secure to date $2.7 million in climate finance. But there is a further $19 million in the pipeline for coastal protection. These grants have included $1.68 million from the GCF to strengthen the adaptation planning. But we've had $500,000 from GCF to strengthen the NDA and country programming. And we've had $460,692 from the GCF for solar electricity generation. And you know that solar is a powerful way of getting cheap energy to the people of Tonga, and there's a lot of sunshine. But we've got a smaller amount, $50,000 from the GEF for enhancing the climate change resilience through improved sanitation and hygiene. And then there was the award of $39,207 from the GCF towards the accreditation of the Ministry of Finance as a GCF direct accrediting entity. Now, the reason that that is so important is that it will enhance Tonga's opportunity to make applications itself and help to really make a difference. But there's also the area of ocean governance, because Tonga is a member of the Commonwealth Blue Charter Action Group on marine plastic pollution and marine protected areas. And on trade, Tonga is a member of the supply side connectivity cluster of the Commonwealth Connectivity Agenda. Now, the reason that is so important is that we have discovered that there is a 19% advantage in Commonwealth countries trading with each other, and we trade 20% more with each other than we do with anyone else. So if we can enhance that, if we can make it faster, cheaper, easier for us to trade with each other, then we can try and redress the damage that this coronavirus pandemic has caused. To date, we have already generated $700 billion of trade between our Commonwealth countries. We would like to raise that to between 1 and 2 trillion by 2030, when we are supposed to do the Sustainable Development Goals implementation. Now, if we work hard together and we concentrate on these matters, then we will do, I think, so much better. And we're very, very proud because our senior director responsible for trade, who I have to tell you we all love, and he is seen as a great champion, comes from Tonga. So Paulo Takoke is ours, but I'm afraid he's also yours, and we're not giving him back.
Thank you, Right Honourable Patricia Scotland, for that. And do you have any last message for our viewers and listeners?
Well, I want to thank the people of Tonga for your courage, for your fortitude, for your determination, and for the flavour that you bring to our Commonwealth family. I think the dedication and support that you've given, not just to the Pacific, but to the other countries of the Commonwealth, are really valued. I would like you to stay safe. I would like you to absolutely treasure the fact that what you have done so far has succeeded in there not being one Tongan to lose their life as a result of COVID. So keep on praying, keep on loving each other, look after each other, stay safe, and may God bless His Majesty the King and the royal family and the people and the government of Tonga. Stay well.
Thank you so much for your time, Right Honourable Patricia Scotland, and we wish you all the best.
And you, stay safe.
Thank you.